Okay, so this is going to be my video first about where to get viable and reliable information about coronavirus. In today's world that we live in, there's a lot of false information out there and a lot of things that can be very misleading to a lot of people. I've heard this year a lot of people that have a ton of confusion about different aspects of the virus, and especially about masks and how effective masks are or are not. And I think we can just go ahead and address some of that in the video today. So, starting off here, we've got the Centers for Disease Control and Prevention, otherwise known as the CDC. This is their main website, and on this main website, we've got a great deal of information. There's news, outbreak information, the CDC in action, and you can learn about a whole lot of things just from this one website here. We've got the MMWR, the Emerging Infectious Disease, the PCD data and statistics there on the right, and then we've got a great deal more information down here. But what we're concerned with for the sake of this video is here right towards the top where it says Coronavirus Disease 2019, and we'll go ahead and click Learn More. So this says COVID-19 alert, cases are rising. COVID-19 cases, hospitalizations, and death across the United States are rising. As cold weather moves in, people spend more time indoors and the holidays approach. Take steps to slow the spread of COVID-19. Wear a mask, stay at least 6 feet apart, avoid crowds, and wash your hands often. The more steps you take, the more you are protected against COVID-19. View cases in the U.S. and your state on the data tracker. Okay, pretty straightforward alert there. And we're going to go ahead and check out this page. So we've got wear a mask, vaccines, holidays, symptom testing and vaccines. So we're going to go back up here and select where it says tips on wearing a mask. And we have how to select masks, and we've got a bunch of different styles of masks up here on a bunch of different people. CDC recommends that people wear masks in public settings, like on public and mass transportation, at events and gatherings, and anywhere they will be around other people. Do wear a mask to help protect yourself from getting or spreading COVID-19. Wear a mask with two or more layers to stop the spread. Wear the mask over your nose and mouth and secure it underneath of your chin. That's very important. I see so many people everywhere. I can't even name a specific place because it's just everywhere. And they will pull their masks down to where it's basically pointless to even wear them. They're basically just wearing them around their chin at that point. It's exhausting. Do not put masks on someone 2 years and younger. Do not put masks on people who have trouble breathing or cannot remove the mask without assistance. Do not wear masks intended for healthcare workers, for example, N95 respirators. Now, this is something I see people doing all the time, wearing specifically N95 masks. And that's something that very commonplace. The CDC, of course, says not to do it, but these are all recommendations updated on the 27th. So, how to select. When selecting a mask, there are many choices. Here are some do's and do nots. Do choose masks that are washable, have 2 or more layers of breathable fabric, completely cover your nose and mouth, fit snugly against the sides of your face, and don't have any gaps. Do not choose masks that are made of fabric that make it hard to breathe, like vinyl, have exhalation valves or vents which allow virus particles to escape through them, or that are intended for healthcare workers, including N95. And this is about gaiters and face shields. Wear a gaiter with 2 layers or fold it to make 2 layers. evaluation is ongoing about the effectiveness of face shields. Face shields are something that I don't see in the public too often. I see sometimes people wearing face shields, but personally, I think a face shield on its own is pretty well useless because you can still breathe in the virus particles even if you're wearing a face shield. A face shield is really only going to protect you, in my understanding, if someone sneezes or coughs directly into your face. Then a face shield will protect you from that instance. But wearing just a face shield it's basically ineffective. I mean, that's not taking into consideration that the virus is going to be in the air around you that can pass around the face shield. So if you're going to wear a face shield, wear a mask underneath of it. Absolutely wear a mask with it. Special situations, and this applies to me, yours truly. If you wear glasses, find a mask that fits closely over your nose or one that has a nose wire to limit fogging. I can't tell you how severe of a problem fogging up of glasses is when you have an 8-hour shift at a job where you can't take your mask off. It is difficult. It is tedious. After hours of working around people with a mask on, you are ready to do nothing except rip that thing right off your face the first chance you get. And you can't always do that, though, when you're in these really, like what I'm doing right now in my job, when you're in these really public places that are not as full of people as they used to be, obviously, but there's still some people, and you still have to deal with that. So, moving right along, special situations. Children. If you're able, find a mask that is made specifically for children. If you can't find a mask made for children, check to be sure the mask fits snugly over the nose and mouth and under the chin. Do not put on children younger than 2 years old. So, how to wear a mask correctly and consistently. And so we have some more information on this. Don't touch your mask while wearing it. Wash your hands before putting your mask on. That's something that, people are going to be fiddling with their masks, especially if you wear glasses. I can tell you from experience, you are going to have to at some point touch your glasses to maneuver them on your face somehow. This is what I was talking about before, is people like this old guy right here, people like this man right here, wearing it on your chin. Don't wear your mask on your chin, around your neck, on your forehead, dangling from one ear, under your nose, on your arm. That one's kind of funny. And only on your nose. All of these are wrong. Then we've got some more information on how to properly take your masks off, how to clean them. Just a lot of information on that. There is a lot of information on here about masks. Let's click on I wear a mask because. Okay, these videos. Okay, we're not going to watch this video. But you get the idea. You've got lots of information. I wear a mask because, and this is a video that I have seen before. But it's a bunch of different people telling you why you should wear a mask. So, wear a mask. Then we can click here on vaccines. Vaccines are the new vaccine information that's coming out. It's just as quickly as I can do research on a vaccine, more information is released about it. So, Pfizer has their vaccine. It's 90% effective. A couple days later, Moderna has theirs. A few days later, Biotech has theirs. It's just a never-ending, almost hourly update to the story. There's so many different companies that are trying to develop a vaccine, and you can find all types of information around this, the vaccine and vaccine creation process here. And then you can click on how CDC is making COVID-19 vaccine recommendation process, and you can learn more about this right here. And they've got lots of good information if you are at all interested in vaccines, how the vaccine is made, how it's made ethically, how it's made in such a quick way. A lot of people are having considerations because they feel that the vaccine has been created too quickly to be effective. And so you've got lots of information here to mitigate that. And groups considered for early vaccination if supplies limited. This is definitely something that's going to be important because we are not all going to be able to have vaccines at once when this starts being possible to give out to people. It's not going to be the common people that get this. It's going to be healthcare personnel, workers in essential and critical industries, people at high risk for severe COVID-19 illness due to underlying medical conditions, and people 65 years and older. So me, someone that lives with my great-grandparents, I don't know if we would qualify for that or not. But we can go ahead and click back a little bit. Oh, here we go. COVID-19 alert cases are rising. And we're going to click on View Cases in the U.S. and your state. And now, this is the best data for tracking information on the virus from day to day, minute to minute, second to second. CDC, this page right here, definitely the best. Not that Johns Hopkins University and the New York Times and the Associated Press all have really good coronavirus. They're very similar pages to this, but they get their information from the CDC. So this is straight from the source. And then here you've got, you can change it to just deaths. You can change it to just cases. And so we can change some of these settings here since January 1st. Change it to deaths. Count, and here we go. There we go. 14 million cases, 13,869 deaths in the last 7 days, and 277,000 total deaths. And then you can look here, and we can zoom in on Kentucky because that's where I am now. Click on it. Takes you to the Kentucky Cabinet for Health and Family Services. And then this is also an agency that's going to have a lot of really good information on here about a wide range of things. Go down here to COVID outbreak. Click on this. And it's going to bring you up to the minute information for people in Kentucky. This is very relevant to me because, you know, of course, I live in Kentucky. We're dealing with different lockdowns and restrictions all the time. Pretty much every county in the state is red right now, which means it's in critical shape. But Kentucky coronavirus monitoring, this is probably the next best source of information after the CDC. Okay, so down here we have statistics for just Kentucky. We've had 2,062 deaths in Kentucky, 30,161 recoveries, 198,000 positive tests, 34,000 probable, 163,000 confirmed, with a total of 2,950,000 tested. So, okay. And so here, where this says PCR, 2,732,000, serology, 96,000, and antigen, 122,000. Those are the different types of tests. And this is something I've had to explain to people before, what they exactly mean, what all the tests mean. But there are different ways to test for coronavirus, and that is a branch of science that is advancing and developing every week. There is some kind of a new test treatment. There are new tests that can be administered in the field and get results in 5 minutes that might render these different types of tests obsolete. They can search for residue of the virus in your body, in your blood, the antibody tests. So there's several different ways that they can test, but healthy at work, telehealth, KY safer. Um, you've got a lot of resources on here: price gouging, face covering facts, Kentucky state agencies to respond. And this would also give you contact information if you needed to make contact with any of these agencies. So this is a really good, just a really strong resource. The CDC website, in connection with the uh, Kentucky Cabinet for Health and Human Services, these two websites together give you a huge amount of information. Now, up next, whoops. Up next on this list is the Johns Hopkins University of Medicine Coronavirus Resource Center. And they have a huge amount of information here. Johns Hopkins has, here they have global confirmed, global deaths, U.S. confirmed, and U.S. deaths. And as you can see, like I was saying before, their statistics are a little bit different from the CDC statistics. And if you had to pick one or the other to go on, I would not hesitate to go with the CDC statistics. Not that there's anything wrong with Johns Hopkins University. It's very reliable, very scientific agency. It's very good information. But here we can look at these articles. The coming COVID-19 vaccine scarcity. Who will get a COVID-19 vaccine in the United States? And these are important questions to ask, because, like I said before, we're not all going to be able to get this vaccine for a very long time. For what I would consider another 6 to 8 months of living like we are now to be a very long time. And then you've got, it says, where are cases rising? COVID-19 data in motion. And so you've got lots of good resources on here. You've just got resource after resource, lots of articles. If you were looking to write a paper about coronavirus, this has got lots of good information on it here, lots of good scientific, fact-based research, and not anything that I would consider false or fake or misleading. We've got Newsweek, unknown COVID vaccine side effects. So, and the last one is the World Health Organization, and we've got lots of good information in it. You can click on, let's see, we clicked on right here where it says all info here on coronavirus disease pandemic, and then you can click on where it says right here, advice for the public, and then this gives options for you to be able to donate, and Mythbusters, advocacy tasks, small public gatherings, and COVID-19. What I wanted to click on here for this video was Mythbusters. So this is very interesting to me. There are millions, if not, I would say probably tens of millions of people who very sincerely believe in some of these hoaxes, some of these conspiracy theories. And so that we'll just go through them real quick. 5G mobile networks, the belief that 5G is literally spreading the virus through the mobile network. Alcohol, not sure if they're saying alcohol will cure the virus. Let's click on it here. The harmful use. Drinking alcohol does not protect yourself against COVID-19. Okay, that makes sense. And then antibiotics will not protect you. Drinking bleach will not help protect you. Cold weather and snow will not protect you. Dexamethasone will not protect you. Other drugs, garlic, hand dryers, holding your breath will not protect you. Even though, okay, I'm guilty of Okay, being able to hold your breath for 10 or more seconds without coughing or feeling discomfort does not mean you are free from COVID-19. Okay, I was about to say if it said holding your breath around people will not help, because sometimes I hold my breath if I'm like around a lot of people until I can get away. Hot and humid climates, hot baths, hot peppers, house flies, hydroxychloroquine, which is some people actually died from that, unfortunately. That you can get CO2 intoxication from masks and exercise, medicines, methanol, ethanol, misinformation, mosquitoes spreading coronavirus is something that is very prevalent in some areas. That there is a difference in older people and younger people risk of getting the virus. Pneumonia vaccines being effective against the virus. Different ways of forms of recovery and immunity. Reduced risk of infection. Saline, shoes, sunny and hot weather, supplements, swimming, thermal scanners, ultraviolet lamps, and viruses, bacteria, and antibiotics. Now, this exists because there is an enormous amount of misinformation in the world on well, it shows you right here. Let's flatten the infodemic curve. We're all being exposed to a huge amount of COVID-19 information on a daily basis, and not all of it is reliable. Here are some tips for telling the difference and stopping the spread of misinformation. So, this person didn't send a rumor to the group chat, and this person double-checked their facts. This person got their news from trusted sources, and this person asked, how do you know that's true? And you see it only got to some of the people. But you can still see that from one person, presumably retweeting or reposting, sent a rumor to the group chat. Okay, so that infects one person, infects 3 people with the misinformation, and then they go on to infect, looks like 9 people, and then those 9 people go on to infect, I guess, 20 odd people, and then we've got, looks like, maybe close to 100 here. So that is how misinformation spreads. That's a really good visualization of it. And so that is my coronavirus information video for this part. Thank you very much for watching this.